I am Dr. Rita McGuire, and this is so exciting. This is the last part of our series. It was a 6-part series on which products do I use for my customers. And it's a really important information that you can take and use as you are really helping your prospects and your customers to get the right product for their challenge, their concern in their life and in their health. I'm one of the co-founders of Wakanna, as well as the chief medical officer. So I want to welcome all of our guests. I want to welcome all of our business partners. As you are coming on the line, we're going to talk about CBD, what it is, how it works, why we use it, and really what products are best to be used in certain situations. The disclaimer. This is a really important information in the disclaimer. The disclaimer is just stating that, we can't make any claims. We can't state that our products can cure whatever disease or challenge this person may have. And it's also important not to give any false or assumptions that these products are going to miraculously work within an hour or a day. Many of our products do take effect immediately, but many times when you're dealing with someone that has a long-term chronic condition, it's best to relay that these products are going to assist with their symptoms. And it's important that you find out, if you're on the line and your business partner, if you're a distributor, it's important that you find out exactly what the person is looking to achieve, right? So if a person comes to you and says, I have cancer, can CBD help? You have to really be intentional and specific in asking, well, what symptoms are really causing you to have a diminished quality of life? Is it the nausea and vomiting from the chemotherapy? Is it the anxiety that comes with the diagnosis of cancer? Is it the insomnia? Because we cannot say that the CBD is going to cure their cancer. So what we have to do is we have to get information out of that person as to what they're trying to achieve. If they have chronic long-term autoimmune disease like lupus, right? What is it that you really want help with? Is it the pain? Is it the irritability? Is it the inflammation? That information will help you to better categorize what products you're going to use initially. So hopefully that helps. That's something you want to get into the habit, because honestly, I get emails and they're just like that. They're like, Dr. Rita, my friend has cancer. What products would you recommend? And I always send you an email back and I say, okay, what symptoms is this person looking for to improve how they're feeling? Because we can't say that CBD is going to cure their cancer. So what specifically are they looking to get help with, assistance with? And then I'll get another email back saying, you know what, this person really is just not sleeping well. If they could get help with sleep, then that would be great. So again, the FDA disclaimer just states that you need to consult your physician if you're on medication, if you're under a doctor's care, if you're nursing or pregnant, and that we cannot make diagnosis to treat, cure, or prevent any disease. So if you're new on the line, I'm Dr. Rita McGuire. I'm an OB-GYN every Wednesday. Pretty much I'm on call here at the hospital. I deliver babies. I do female surgery. I trained at Wayne State School of Medicine in Detroit. I did my residency at Cook County. I am the CEO of RJM Wellness and Rita Fitness. I do a lot of health and wellness speaking and seminars. I'm also an advocate for the cannabis plant. I am a member of the Doctors for Cannabis Regulation, as well as a certifying physician for medical marijuana cards here in Illinois. I'm owner of the Travis Garza Fat Loss Camp in South Florida. I'm an MBA candidate. I am going to be going to Atlanta Sunday through Wednesday, taking my final exams. I will be a trichology instructor. I will be able to teach trichology students, so super excited about that. So you will have a guest next Wednesday because I will be taking my final exams in Atlanta. I have 3 amazing children. They're all adults. Jacob is 30, Joshua is 25, and Hannah is 23. They are my why. They are the reason why I am building a legacy in the cannabis industry, wealth in the cannabis industry to leave behind for my great grandchildren. So yes, I'm still a practicing physician. I am getting my MBA so I can transition out of clinical medicine and really concentrate on healthcare reform, reducing disparity in healthcare, a more an administrative role, along with building my Wakanna business, because I am a distributor as well, building my business. I testified in front of the Judiciary Committee, and this was really quite exciting because as a physician testifying in front of the state legislators on why cannabis should be offered as a holistic medicinal benefit or option for patients was just very eye-opening for myself, being an OB-GYN, not knowing 4 years ago, before anything about the cannabis plant, because it wasn't taught in medical school. So that was pretty exciting as well. So here are the other co-founders. If you're a guest on the line, just want to quickly introduce you to our CFO, Dr. Patricia Van Pelt, who's a state senator here in Illinois, serving her 3rd term. Our CEO, Melissa Boston, is our visionary behind Wakanna, and our CSO, our Chief Sales Officer, Phyllis Nash. We've coined our midwife, who is birthing all of the possibilities that we have in building our businesses. So each one of us, we own a pillar. I'm the pillar of health. Dr. Patricia Van Pelt is the pillar of wealth. Melissa Boston is the pillar of legacy, and Phyllis the pillar of freedom. So we have 4 pillars here at Wakanna. We are the crown jewel of CBD, but health, wealth, legacy, and freedom are the 4 pillars. So a little bit about the plant. When we talk about cannabis, the first thing that comes to your mind is what? Getting high. That was the first thing that came to my mind when I heard about cannabis. But what's interesting is that we don't hear about the other part of the plant. One part gets you high, marijuana, but there's another part that gets you healthy. It's called hemp. And so all of our products are sourced from the hemp species, which contains, by definition, 0.3% or less of THC. That is the magical number that you'll hear a lot, because that is the legal limit of THC in the United States that defines hemp, 0.3% or less. So when we look at all of the compounds that the cannabis plant provides us, CBD is the hero, or maybe the shero, right? CBD has a long list of medicinal benefits, from being an antibacterial to antifungal to antiviral to anti-inflammatory, to help with nausea and vomiting, to help with seizures, to help with inflammation and pain, to help with skin disorders, to help relieve pain and anxiety and depression, to help reduce the arterial blockage, to improve diabetes, to improve hypertension, to improve cholesterol. Whew, I'm out of breath, right? Talking about all the benefits that CBD offers the body. Well, there are other compounds or cannabinoids that also work in synergy with CBD that offer other benefits. So when we look at something like Delta 8 THC or Delta 9 THC or CBC or CBG, we see that the additional benefits along with CBD is truly, truly dramatic when we talk about building our health to be in a better state. So CBD works by the human endocannabinoid system. This is the science behind how CBD works. And this is important if you are a customer, if you're a guest on the line, that you understand that when we consume CBD, it binds to receptors in our body to send signals to different areas of the body to either help us sleep better or to reduce inflammation or to reduce stress and anxiety or to improve our blood sugar or our blood pressure or to help our hair grow or to make us feel more in the mood with libido. So the endocannabinoid system has receptors, CB1 and CB2, and receptors in main organs like our lung, our liver, our kidney, our skin, our teeth, our stomach, that make our body in balance. See, our body is out of balance. Our body is out of balance because of the stress we're under, the sleep we're not getting, the water we're not drinking, the air we're breathing. So all of these are factors that tear our bodies down, that cause free radicals to tear our body down. So CBD is an antioxidant as well, which I failed to mention, that really help to protect our body from being torn down by free radicals. So there's different ways that you can consume CBD. And that's what I love about Wakanna products. I mean, you can vape, you can use our Cbd capsules, our CBD capsules. We have tinctures with oils you can put under your tongue. We have topicals that you can rub on sore areas of your body. We have edibles like gummies and spices. We have shampoo. We have facial serums. We have body creams and body lotion. I mean, I can go on and on about all of the different products that you can consume and the different methods. It just depends on your condition. So this is our product line. Again, we have a black label line. That's our power products. They contain the legal limit of THC, which is 0.3% or less. And then we have our pure line. Our pure line are the products with the white labels. Those are our broad spectrum products that contain less than 0.0% of THC. And again, like I said, we have a shampoo line, our Save Our Strands. We have gummies, we have topicals, we have spices and butter, we have essential oils, we have a whole weight loss program as well. If you joined in late, I can't stress this enough, our FDA disclaimer is that these products are not intended to diagnose, treat, cure, or prevent any disease. What we want to do is use these products as a tool in our toolbox to address symptoms that these chronic disease and illnesses can cause, right? We know that CBD is not FDA approved, so we cannot make those claims, but we absolutely can help with these symptoms that many of these disorders have. Our products are tested. In fact, this is our lab, Green Scientific Lab. It's in Davies, Florida, right next to Fort Lauderdale, right next to the gym that I own, in Hollywood, Florida. And they are amazing. Not only is the staff very approachable and always available. In fact, I speak to Dr. Marsh at least 2 to 3 times a week. He's their chief scientific officer. Their instrumentation is state of the art. There's nothing that they don't have that is the state of the art for testing for potency, heavy metals, pesticides, mold, mildew, and residual solvents. And that's exactly what we test in our products. And you may ask, well, why is that so important? Well, it's really important when you are internalizing a product. If it has heavy metals, if it has mold or mildew, it can make you sick. And if you're talking about giving these products to an immunocompromised person, maybe your family member that may have cancer, maybe a family member that has HIV/AIDS, or maybe a family member that has an autoimmune disease. Well, that could really harm them. So certificates of analysis are crucial. They're critical. But guess what? The FDA is not mandating that a CBD company does testing. But guess what? We do at Wakanna, because we want the highest potency and purity of CBD products on the marketplace. So our certificates of analysis test all that: the potency, the pesticides, the residual solvents, the microbial analysis, as well as mycotoxins, heavy metals, and terpenes. Terpenes are a part of the plant that also provide healing properties. So we even test our products to ensure that they have terpenes as well. Well, tinctures, we talked about tinctures. Tinctures are a great way to get CBD into the system. Tinctures are taken twice a day, and tinctures are placed underneath the tongue and held there for 60 seconds before you swallow, so that the tincture can really get into the bloodstream and start working. Takes about 15 to 20 minutes for tinctures to start giving you some sort of relief, but 3 drops twice a day is a great, great way to start. Now, you may have a customer that says, you know, these 3 drops twice a day are not doing it for me. No problem, you can increase it to 8 drops twice a day. And I like to say between 4 and 7 days to increase that if it's not where that person is wanting and seeing results. The maximum dose is 15 drops twice a day. Again, we have 2 product lines. We have Power, those are the black labels, full spectrum. They have the legal limit of THC. The magical number is, you got it, 0.3% of or less. And then we have our pure products. Those are our broad spectrum products. They contain less than 0.0% of THC. Those are products that those who have random drug screens can take. So the pure is for those who have random drug screens, and the Power are for those who do not have random drug screens. We also have a product you can put in water. You can put in juice. You know, I'm doing a detox. You can put it in anything liquid that you're drinking or even eating. We have another product. We're going to talk about this one tonight. It's called Himbranium Md. It's the medical grade of CBD. It's our highest formulation or highest potency. It's 900 milligrams of CBD in that 15 ml bottle. We're going to talk about some conditions where Himbranium Md is absolutely something you want to think about. We also have Empowered Hair. It can be used as a tincture. It's a product for alopecia, for hair thinning, for hair loss. It can be used topically as well as underneath the tongue. Again, if someone has a random drug screen and wants to address their hair thinning or hair loss, you would use the Himbranium or Hempowered hair topically. So let's move on. Again, this is a great diagram of how you use CBD oil, putting it under the tongue, holding it for about 60 seconds before you swallow so that it can really get into your bloodstream. Some people, it may take as long as 2 hours to start taking an effect, but typically it's 15 to 30 minutes. Again, start slow, 3 drops twice a day. So some things that affects the CBD absorption is food. You can take it with food. Fatty foods actually help the absorption to be even more. And then if you want to increase it even further, you can actually hold the tincture under your tongue. Instead of a minute, you can hold it for 2 minutes. That will increase the bioavailability as well as the absorption of the CBD. Now, our Smokables are great, great products. In fact, my son has my cartridge. He stole it. I love the Smokables because they work fast, within 1 to 5 minutes. We're going to talk about another scenario where the Himbranium Md and the Smokables are going to be a really good pair. We have cartridges, our Power cartridges. We have our Delta 8 cartridge. We have pre-rolls. We have CBD flower and Delta 8 flower that's already rolled up in a joint. And then we have our premium flower that's loose that you can roll up. What I love about Smokables is that they work fast. So if you're looking for relief within 5 minutes, you absolutely want to take 1 to 3 pulls on your Smokable, and you only need to do that about 3 times a day. Also, if you know someone that smokes cigarettes, that is addicted to nicotine, you can use a Smokable. You can offer them a Smokable. Every time they have the urge to smoke a cigarette, offer them a pre-roll, offer them a cartridge. That will block the craving and the cycle that nicotine and other addictive behaviors have. So real easy to vape, pre-roll. You take a single inhale, wait a couple of minutes before inhaling another time, hold it for 3 seconds in the back of your mouth, and then exhale. So there are YouTubes on it, but it's a real easy thing. But certainly if you are helping someone who smokes already, they know how to use a vape and a pre-roll. Our edibles are absolutely amazing. My 25-year-old he's going to buy like 1,000 bottles of Flight 25. I'm telling you, the millennials love our Delta 8, but he said tonight before I left for work, he's like, Mom, the Delta 25, the Flight 25 is where I need to be. The Flight 50 was a little bit too much for him. But our edibles include our flat belly gummy, which include CBD, as well as our power gummies, our broad spectrum gummies, our flat belly gummies. We also have our bitter teas, our immune defense teas. We have great products that really will assist with inflammation, will assist with sex, creativity, libido, stamina, energy, as well as sleep. So how do you use a CBD gummy? Well, gummies take about 90 minutes to get into the bloodstream. So you want to take these gummies at least 90 minutes if you're talking about wanting to get some good sleep, or at least 90 minutes if you want to get things riled up in the bedroom, or at least 90 minutes if you really are trying to be creative or finish a project, you want to be more focused. It takes that long because the gummies have to go through the digestive system. Start low and start slow. Start with 1/4 of a gummy with those Delta 8s. Start with 1/2 a gummy with the power or pure, and then work yourself up, right? You'll be amazed at the amount of CBD that you actually need to get results. More is not better. Topicals are absolutely products that you must have. Why? Well, because everyone has Bengay or BioFreeze or something like that in their home, right? Instead of using that, you can use a topical that offers relief locally. It reduces inflammation, it reduces pain. Our Extreme Power Pain Cream is our #1 seller. Our #1 seller week after week after week, month after month, year after year. This is a cream that I use at night. I like using this one at night so that the cream can really set in and be very soothing, and I not have to wake up in the middle of the night because I have discomfort. Our other pain product is our liquid reliever, our Dr. Reader's Rub. I use it during the day. It's in a roller ball. You can easily apply it during the day, as well as it's very mobile, it's very portable, it's very convenient to carry around. We also have body butters that are infused with CBD, with hibiscus and lotus, that really help to get you in the mood if you need that. Even our aftershave butter. We have a Power Body Mango Cream Lotion. It's great for those who are looking to relieve dryness that they're having from washing their hands so much, or maybe they want to address symptoms due to psoriasis or eczema or acne. Yes, they can use that Power Body Mango Cream and not worry about it passing in the blood-brain barrier, meaning that they can pass a urine drug screen. Our Holy Glow, our facial serum I use, is a great serum with CBD. We know that CBD has receptors in the skin to help prevent wrinkles, to help restore anti-aging properties. And then we have our Oud body oil, which is a great oil, doesn't contain CBD, but is an amazing oil for the skin as well. How do you use topicals? Very simply, apply to affected area. You can apply it to areas that are causing discomfort due to sciatica or neuropathy, or even a headache, taking a small amount and putting it on the temples or the back of the neck. Wherever the pain is, carpal tunnel, right? You can apply the topical to that area. It takes about 5 to 10 minutes, but absolutely, we have an amazing proprietary formula on these products that we've used essential oils to enhance the CBD, anti-inflammatory, and pain properties. Our sexual health products, again, are used topically with the exception of the King of the Jungle Gummy. So all of the topical products here are safe if you have random drug screens at your job. Our CBD lube, our Cherry Bliss is edible, so you got to be careful. If it's an edible product and you have urine drug screens, you may want to use the G-Spot. These are products used for vaginal dryness. These are products that will help to enhance intercourse. It will cause those receptors in the vaginal vault, in the vulvar area, in the clitoris area to be more sensitive. King of the Jungle gummies are for men or women that are looking for more stamina. They're looking for an increase in libido, and they're looking for more improvement in their sexual performance. Our Sos Hair Care, amazing products. I use them all the time. Our Sos Hair Care is infused with CBD. So we're having shampoo, conditioner, moisturizer, the styling cream. We even have a product for men and their beards if it is thinning. So these products are organic products. These products are great for not only hair thinning, hair loss, but what we've noticed is a lot of patients who have had COVID lost their hair. So really helping to restore that healthy head of hair. And it's great for people who want to maintain a healthy head of hair. Now we do have a CBD capsule form. Our CBD capsule form is a proprietary formula with the chaga mushroom. It's called our Power King to Chaga. It is a great product that, again, takes about 90 minutes once you swallow a capsule. It's got to go through the digestive system. The chaga mushroom is deemed like a superfood. It has B complex vitamins. It's high in vitamin D, potassium, fiber, zinc, iron, magnesium, calcium, and selenium. This mushroom has all the great properties and benefits to help to assist with blood pressure, blood cholesterol. It helps to support your immune system. It helps to fight inflammation. It also helps to improve cholesterol levels and blood sugar levels. Now, there is a little caution that if you're on insulin or other blood sugar medications like metformin, you want to make sure you're monitoring your blood sugar, because the chaga mushroom really does work well in normalizing blood sugar. Our essential oils are another great line of products. I want to really concentrate on our first defense. It's a nasal spray with CBD and essential oils. You know, the virus, bacteria, germs get in through that nasal passage. So this is a great product, not only for this time that we're going through in a global pandemic, but for those, this is allergy season, right? So this is a great product to reduce those allergens, the inflammation that they cause, as well as protecting our immune system during this global pandemic. Black seed is another essential oil that I recommend for all diabetics. Black seed helps to rebuild the beta cells of the pancreas. Those are cells that help to provide insulin to the cells so it can lower blood sugar. So these are all great essential oils. We'll talk about tea tree and peppermint. in a scenario tonight, but just know essential oils are great. I've been getting a lot of questions about surgery, surgical procedures. Can you help customers that are undergoing surgery, appendectomy, breast biopsy, carotid endarterectomy, that is operation on the carotid arteries, cataract surgery, cesarean sections, that's what I do, cholecystectomy, gallbladder, coronary artery bypass, debridement of wounds and burns or infections. I'm a wound physician. And so all of these things are questions that we should be able to help customers with their post-op surgery. Now, post-op, what happens? After surgery, your doctor usually gives you an opioid. And I find a lot of people are in pain because they're afraid to take the medication their physician gave them. Why? Because they're afraid of becoming addicted. We're in an opioid crisis epidemic. People are overdosing on opiates. Many people are overdosing on opiates that were given to them post-op or post-surgery that now they've become addicted to. And it's really sad because this is not something they asked for or wanted, but it can happen to any of us. So here are some of my recommendations for those who may have had surgery, right? One thing that you want to know is that you never ever put anything in a surgical wound, right? So we talk about relieving pain in someone that may have had a surgery and has an incision on their body. Yes, you can use the topical pain cream, but you want to use it on the outside of the incisional area. You never want to put liquid or cream or anything inside of the incision. What will this do? Well, this will aid in helping to reduce pain. I recommend the Himbranium Md, that's our medical grade CBD tincture, because a lot of people do not like taking opioids. They refuse taking the Vicodin. They refuse taking the Percocet, right? They want to take something natural and holistic. Well, guess what? We have the answer here as an option. So 3 drops twice a day would be a great starting dose for a post-op person. Now, in surgery, in OB, in any of the surgical fields, we talk about breakthrough pain. Breakthrough pain is when you're on a pain medication and you have pain that breaks through and is not being relieved by that medication your doctor has you on. So I recommend one of our smokable products, either the cartridge or the pre-roll, for you to use for that breakthrough pain. When it may not be time again to do some more drops of the Hemp MD, right? You can do 1 to 3 pulls on a smokable and it's going to offer you relief within 1 to 5 minutes. So that's my recommendation for breakthrough pain. And then we can't forget about sleep. Most people who have had surgery, they're tossing and turning. They may have discomfort. They can't sleep. So I recommend the Flight 50. Yes, the Flight 50. A fourth of a Flight 50, 30 to 90 minutes before they go to sleep. You can start with the fourth, and if they need more because of the pain level, they can take more. But typically, a fourth is all they need. So these are my recommendations post-op. Remember, do not put anything in the incision. You can absolutely use it in the surrounding area. The Hemp MD, the medical grade CBD, along with the breakthrough pain for the use of our smokable, and then the gummies at night. Now, healing. Essential oils, and I'm going to have Dr. Betty at the end kind of chime in, but essential oils can be used in those situations when that wound or that incision may be healed and just, ooh, it's just an ugly scar going on, right? So these are some of the essential oils that you can use. Eucalyptus, peppermint, tea tree. Remember, they need to be diluted With the carrier oil, what my number one recommendation is tea tree. Tea tree oil is a great essential oil that will help the healing of the wound once it's closed. So let's talk about a couple of scenarios that we've talked about at the very, very beginning, and then we're going to end about 15 minutes early so I can take questions. But what happens when you run into that customer or that person that says, I'm not on any medication, I don't have any pain, I sleep like a baby, I don't have any stress in my life, I am just the happiest person in the world, okay? They still need CBD. And why do they still need CBD? They still need CBD because the endogenous cannabinoids like anandamide and 2-AG are deficient. And they're deficient because of the air that this person is breathing, the pollution, the type of Western diet that we're eating. Believe me, their body is out of balance. And they absolutely want to use CBD to prevent any conditions from occurring down the line. So as we age, we are at a higher incidence of developing diabetes or hypertension or arthritis. So this is a great way to keep the body in balance with our customer variety package. This is for overall wellness. When you're looking at someone who is in good health and they want to maintain that good health, the customer variety package comes with our Power Himbranium, our Power Gummies, our Pure Gummies, our 4-pack Power Gummies, our Power Extreme Pain Relief Cream, our Hemp-Powered Hair, and our Power Relief Pain Cream 400 milligrams. So it comes with the small one and comes with a little one. So these are the products that come in this variety pack. And what I recommend is that you really push this package on people who are well, who are overall in good shape. Because as we age, guess what happens in women? Menopausal, our hair thins. It thins because we have a drop in estrogen and other hormones like progesterone. So they're going to need that empowered hair, men and women. So I recommend 3 drops twice a day of the Himbranium 500 milligram tincture. I recommend a Pure Gummy midday. A Pure Gummy midday will keep the body in balance and will keep the person calm without having that sedative effect that maybe that Power Gummy would give. The Hemp-Powered Hair to affected areas twice a day, topically. The Power Gummy at night for sleep, and applying the topical pain relief for inflammation or pain, or just to help relax the muscles at night. Sometimes I'll put the cream on in different areas that may have had some discomfort, but maybe not necessarily at night, but it just helps to relax the muscles. Customers who get drug tested, I recommend the Pure package. This is a great package for that person who is looking for overall wellness to be continued. They may have some issues, but they want to keep the body back in balance. That's our Pure package. It comes with the topical extreme pain cream. It comes with the broad gummies. It also comes with the Hemp-Powered Hair and the Pure tincture. Again, I recommend applying that Power Extreme pain relief to affected areas. I recommend doing that Pure Gummy twice a day, and absolutely the Hemp-Powered Hair to an affected area of thinning or concern twice a day. So this is a great package, again, for someone who's overall healthy, they want to maintain that health, or someone who may have random drug screens and may have issues they want to address. So when we talk about pain, pain is the #1 reason that people go and use CBD. Pain can come from rheumatoid arthritis, fibromyalgia, cancer, multiple sclerosis, stomach ulcers, AIDS, gallbladder. I can go on and on and on. Pain can be a nuisance. And so customers who have mild pain, it could be neuropathy, it could be sciatica. You'd never want to just recommend one pain for a product for pain. You never just want to give a person the extreme power pain cream. They need the layering effect. They need to reduce the inflammation in the body 24/7. Now, once these products get into the system and once you resolve these conditions, yeah, you can back off and not use all the products every day. But I recommend the Himbranium 500 milligrams twice a day. The Power Gummy at night, you can start with half or one gummy at night. I like using the Dr. Rita's Rub during the day. I like to just have that. It's mobile, it's flexible to use and carry around. And then at night to apply the Extreme Power Pain Cream. Pain can come from headaches. Pain can come from a situation where you may be in the gym every day, right? And you're in pain. Just know that you can apply the topical cream wherever the pain is. I always like to mention that try a small area, a patch test, before you start putting a large amount. Just because those essential oils, there's some people that may have a sensitivity to essential oils, so you don't want them to break out. So a small patch test. Now, what about that customer that has moderate to severe pain? They tell you that the quality of their life is diminished. They can barely get out of bed in the morning. Well, they're going to need some heavy hitters. You're going to have to take it up a notch on those folks, right? You're going to take it up a notch and recommend the Himbranium Md. That is the medical grade CBD tincture that we offer here at Wakanna. The Flight 50, that's that Delta 8 that really is very effective for moderate to severe pain. And then our Power Extreme Pain Cream and Dr. Rita's Rub. Again, you want to use the Dr. Rita's Rub during the day, apply as needed, and the Extreme Pain Cream at night. Neuropathy is another reason for pain. Again, I can't stress enough that black seed, do not overlook this essential oil black seed. I always add it into the mix. We're talking about neuropathy that can be due to those who are diabetic. So some of the symptoms they have is numbness, tingling. They have localized pain, loss of balance, abnormal gait, cramps, muscular weakness. They can have a variety of symptoms, but neuropathy is just awful. So I recommend if they're undergoing drug screens, they can use a pure tincture or the Himbranium 500, the Dr. Rita's Rub, the Power Extreme Pain Cream, and black seed. Black seed will also reduce inflammation. It will help normalize blood sugar at the same time and really help with neuropathy. Take that pain cream and tell them put it on the soles of their feet. Wherever the neuropathy is occurring, they should apply it there. We talked about gout before. Gout is another very painful condition, but it's intense and it's sudden. And that's why I recommend the Smokables for any gout flare or lupus flare, anything that can flare up migraines. You know, these are conditions that can flare up at any time when there's a trigger. So the Smokables I recommend because they work within 1 to 5 minutes. The Power Gummies for night. And then also the Dr. Rita's Rub or the Power Extreme Pain Relief Cream. You can rub it. See, gout usually happens on the big toe or the elbow. So you can take that topical and just rub it in that area and then layer it with the Himbranium 500 milligrams, 3 drops, 8 drops, or 15 drops twice a day, which is maximum. We talked about menopausal symptoms. Yes, CBD will help with menopausal symptoms as well, using the gummies, using the tincture, and using our G-Spot or CBD lube, as well as our CBD infused hibiscus and lotus body cream. Hypertension and diabetes and high cholesterol, absolutely yes. CBD can assist with those symptoms using either the Himbranium 500 or you can use our Power King T'Chaka. You can use the capsules. What I love about the capsules is not everybody likes to swallow a tincture. So we have capsules that have CBD along with the chaga mushroom to address symptoms due to hypertension, diabetes, and high cholesterol. Along with this, I always recommend peppermint and our gummies. Peppermint gives folks that energy they need, and the gummies help them to sleep. Diabetes as well. Again, I threw in that black seed. Whenever you're dealing with a diabetic, even though our Himbranium 500 milligram is infused with turmeric and black seed, I always like to add additional black seed, 3 drops twice a day to the tincture. Now, you may have that person that doesn't like using a tincture. We'll offer them the Power King T'Chaka. That will help to normalize blood sugar, blood pressure, and blood cholesterol. Again, if they have any issues with fatigue or pain, you could throw in that peppermint and that Power Relief cream, along with cholesterol. Cholesterol levels can be reduced by the chaga mushroom. Do your research. A lot of research that talk about how chaga mushrooms help to reduce cholesterol, as well as black seed. Black seed studies have shown that black seed helps to reduce cholesterol. And then if they have pain in lower legs, you can offer them that pain relief. So you can see when we talk about different conditions, it's never just one product. Never offer just one product, because most of these conditions need more than one, because they're chronic, they're long-term. They need CBD in the system 24/7 to really have that synergy to release and to reduce inflammation. Hypo and hyperthyroidism, again, they have a lot of hair loss in hypo and hyperthyroidism. So you want to address their hair loss with our SOS, Save Our Strands system, along with the Empowered Hair, along with our weight loss products. You know, hypothyroidism really slows the metabolism. Many of those folks are heavy and they blame their thyroid on it. So we can get that thyroid back in balance and offer that flat belly package. And for those who smoke, we have something. It is an addiction. And when they stop smoking, they typically go to eating. So we have products to offer them, like our smokable products. Each and every time they have the urge to smoke, give them a smokable. Give them a cartridge. Give them a pre-roll. 1 to 3 pulls is all they need to reduce that craving. They also need the Empowered 500 milligram twice a day. They need that to reduce the cravings in the brain that takes them back to that nicotine. So twice a day, a gummy at night to help them sleep. And again, peppermint spray. Peppermint spray will improve their mood, give them that energy. But absolutely, I've had so many clients and patients use our smokables and our tinctures to help them get off of nicotine. We talk about cancer, specifically prostate cancer. I get a lot of questions about. In prostate cancer, they have painful ejaculation. They typically have metastasis to their back, their bones, their back, their hips, or their pelvis, so they have pain. So you want to offer them the Himbranium Md, our medical grade. You want to offer them the King of the Jungle to help with their ejaculation and to help with their stamina and libido. And you absolutely want to offer them our topical pain relief. Now, I'm going to end it with fibromyalgia and take some questions. Fibromyalgia is another autoimmune condition that is debilitating. I'm telling you, along with lupus and multiple sclerosis, these are conditions that are causing a lot of stiffness, fatigue, pain, hair loss. These folks really need our whole line of product. But let's start specifically with addressing their pain, their stiffness. We can do that with our topical. Let's address their fatigue. They're typically fatigued because they're not sleeping well at night because they're in pain. So the flight 25 or the delta 8. And then we want to normalize and keep the body in balance with CBD by offering them the Himbranium 500 milligram. You always want to offer that tincture, that flagship tincture, so that CBD is in a steady state for the 24 hours to give their body that reduction in inflammation, to give the body a reduction of the free radicals that are causing the body to deteriorate. So I'm going to stop it here. I'm going to take some questions. We have Dr. Betty on the line too. So if we get any questions about essential oils, she can address that. I don't see any questions at all. Let me look in the Q&A. Sometimes there are questions there. I don't see any questions in the Q&A. Let me know if you have any questions at this time.
You were pretty thorough, Dr. Rita.
Uh-oh.
With the essential oils, you've upped your game.
I upped my game, huh?
Yes, ma'am.
Dr. Crawford is on too, so if you want to chime in on anything, Dr. Betty, you can at this time. But I want to thank these are members of our medical advisory board, and I just really appreciate their input, their knowledge, and their expertise. Take it away, Dr. Betty, if you want to say something.
Seriously, you were very, very thorough. One of the things that I did think about, though, is especially with peppermint oil. You know, the season is about to change, and we've got, well, with the summer, we had the mosquitoes, we got spiders, we've got mice and other insects, and peppermint oil is excellent to keep them at bay. So you can take a cotton ball and put it in various areas where you see these insects, and you probably won't see them again. Black seed, like Dr. Rita said, black seed is just the consummate oil to use for so many different issues, and it should be used on a daily basis. It can be used topically and internally, just as she said. Those are the main ones that that I thought about, things that I wanted to bring forth. So if anybody has any questions, further questions about any of the essential oil, please feel free.
Thank you so much, Dr. Betty. And I'm so glad that this question came up again. And the question is, I asked yesterday about sarcoidosis. So I want to know specifically what you want to know about sarcoidosis, or what that person is looking to achieve with our products. This is a really good question, guys, because CBD cannot cure sarcoid. So I need to know what specific challenges that person has with sarcoid that they want to address. And that way, if you ask very intentionally, then you can really be intentional with the products that you recommend. So if you can give me an answer about sarcoid, what symptoms is that person wanting to address? So yes, yesterday I suggested Hemp MD and gummies and topicals, because typically sarcoid patients have a lot of inflammation in their body. They have typically certain organs that are affected, like the lungs specifically, sometimes the kidneys and other major organs. So first, you want to reduce inflammation in the body. You can do that with the Hemp MD or the Himbranium 500. Okay, so the specific challenges are pain. Okay, so with pain, you want to recommend the topical products along with a tincture, so that when that topical product is wearing off, you've got that tincture in the body working. Breathing issues, Breathing issues, again, are a result of the inflammation that sarcoid has on the lung. So yes, the CBD will reduce inflammation. It will help improve breathing by reducing inflammation. Remember, it cannot cure sarcoid, but it can improve the symptoms that they may be having with their breathing. Eucalyptus is another essential oil that will help. Infusing eucalyptus can help with the breathing. And sleeping. Sleeping, again, the gummies, either the power gummies, the Delta 8 gummies. You want to use something pretty moderate to heavy duty for sarcoid because it is a chronic long-term condition. So you'd want to hit them with some pretty potent products. That's why I recommended Himbranium Md. And then skin issues. They do have skin issues like other autoimmune conditions. Skin issues can be addressed with our Power Mango Body Cream. Skin issues, again, you always want to test the skin with a little patch test by using some of the body cream in areas before you lather it all over. So yes, sarcoid, pain, breathing, sleeping, and skin issues. That is a really good example, guys, of questions you want to ask when people say to you, well, will CBD help with my, and you want to ask them, well, what exactly are you looking to improve? What challenges that you are looking to improve with our products? And once you ask them that question, they can tell you sleep, skin, whatever, they have.
Dr. Rita, let me also remind everyone that black seed is excellent also for any kind of breathing disorders or respiratory problems. It helps to decrease allergic symptomatology, and it also is very highly anti-inflammatory, not to mention that it's also a very strong antibacterial, so that many times people with sarcoidosis, because of the limitations in breathing, might have a tendency to develop some bacterial infections. So this is adding black seed to that regimen will also be of great help in terms of prevention.
Dr. Rita.
And,
yes.
I'm sorry, and
Dr. Betty. Yes, and
the entourage effect, where the various properties of even the essential oils combined with the CBD gives you a bigger punch for a bigger effect than just using any one of them individually. That's it.
Okay, and then Dr. Rita, in the question and answer, I'm not sure who Barb Green is, but there was a question about dementia anxiety, and then in the chat about anxiety. If you can answer that. Did you see those?
I didn't see them.
Yeah, so in the question and answer.
Okay, what does it say? Oh, I see. Oh, great. Thank you. You guys are amazing. They get it. They get it, right? So specifically, how to manage the agitation that goes along with confusion after sundowning. My husband has real bad migraines, headaches. Okay, so sundowning and dementia and agitation. Absolutely, you want to use the Himbranium 500 milligrams or the Power water soluble. I like using the water soluble in those who have dementia because sometimes they have that cognitive dysfunction. They can't hold the oil underneath their tongue. Sleep. Sleep is a big reason why they're agitated as well. So you want to make sure that they get good sleep. Using a power gummy at night is great, about 30 to 60, 90 minutes before they go to sleep. You also want to have a diffuser in your home. you know, diffusing some of our essential oils, like the essential defense, just having an environment that's nice and calm is a great thing for those who have dementia, who have agitation, and the sundowning as well. So essential defense, diffusing essential oils is good. The tincture or the water soluble, the power water soluble in their food or their juice. And then also the gummy, so that they can rest and get that restorative sleep. So that has been quite helpful. I know in Dr. Rashonda Conti's mom, I mean, that's one of the reasons why she has been such an advocate and such a builder here at Wakanna, because of the results that her mom had, who has dementia, with our products. Oh, Barbara Green, I met you this weekend. Yes. Thank you, Barbara Green. My husband has real bad migraine headaches. So migraine headaches, I love using the topical in the area of the temple or the back of the neck. I also like using the Smokable 1 to 3 pulls that will help to really calm that migraine down quickly as the tincture is working. And then also a gummy at night for sleep is really good. But using just a small area or a small amount of topical in the area where the head is hurting is really, really good. I like peppermint too for migraines. Taking the peppermint and just putting it in the palms of your hands and using your hands as a diffuser to inhale that peppermint really helps to reduce migraine headaches. So Himbranium, 500 milligrams twice a day, the gummies, the topicals, and a smokable for that acute onset of migraines is really good. Now, I have a very dear friend, her mom was on Imitrex, and guess what? Her mom no longer uses Imitrex. Every single month she orders from me. Every single month she orders from me, because these CBD products have been so helpful, much more than Imitrex has ever worked for her migraines. Was that it, Dr. Tyus? I think that was it. That was it.
Yes, that was, yep, that was it.
So
I typed in a little information. Yeah.
It is 9:04 and I've got to hop on another webinar. So hopefully this series has been helpful. I'm going to think of what I'm doing next week, because I will be taking my final for my trichology certification. So you will have a guest. One of the Wakanna Medical Advisory Board members will be on and will have a very informative presentation. I do want you to email me at ritamd@wakanna.com with any additional questions, concerns, critiques. I am always available via email, ritamd@wakanna.com. I look forward to your emails. I look forward to your suggested topics that we go over. But hopefully this has been helpful, because we have so many people to help. We've got so many friends, family, co-workers, neighbors that absolutely need our product to help with their overall health in a holistic, natural, and organic way. So be well, be safe. We will see you next Wednesday. And thank you, Dr. Betty. Thank you, Dr. Crawford. Thank you for assisting me this evening. Thank you for your knowledge. I want to thank our guests. I want to thank our business partners. Guests, if you're on the line, please connect with the person who invited you so you can order these products, you can order these packages, and you can get back on track to better health. Be well, God bless, and we'll see you soon.